studies. So at the end of this module / lecture,
Recording in progress.
Each of you is expected to have a foundational understanding of descriptive studies in health research and medical research. You must be able to recognize the purpose of these research methods and the situations in which they are appropriately and properly utilized. Okay? And we also will look at the advantages and disadvantages, the strengths and weaknesses of these descriptive studies. So these are my sources, and by sources, I have taken the liberty of converting them into a QR code in case you would like to scan and peruse at your own leisure. These are taken from the PubMed website. So, yeah. So let's have a brief run through of study designs. Okay. In general, there are two kinds of study designs. You have your observational versus your interventional studies. And these two are basically ones where you just, as the name already says, look at or observe a certain variable, a certain population or a certain sample of the population. And ones where you actually introduce another variable and see its effects or outcomes in a sample or in a population. So these are natural versus controlled scenarios. And we always keep in mind, why do we do the former? Why do we do the latter? So for the former, it's when we want to see the effects of a certain exposure, okay? So ethically, we're not supposed to bring about harm towards our study participants or our study subjects, okay? So we want to see what happens when, or we want to document what happens when they are exposed to certain contaminants, certain pollutants, certain compounds that that happen because of, say, an accident or it exists in the environment. So why do we do the latter? The latter, when we want to study the effects of a possible drug, a possible pharmaceutical agent, okay? And then under your observational studies, so this is a subset of your observational studies, you have your descriptive versus your analytical studies. So for the latter, your analytical studies, they try to establish, if not a correlation, a basic correlational, an actual causal relationship between the exposure, so your one variable, and then your outcome, another variable. So descriptive studies overall do not establish a causal relationship between your variables. And they are basically a method for communicating with your fellow researchers, with your fellow scientists, with fellow clinicians, with regards to a novel or an interesting new phenomenon, disease, syndrome, or symptom. So these are ways in which we discover or we tell other fellow health workers about new clinical phenomena and how we are able to identify them. Okay. So this is important, and whenever I give a lecture, I always try to tell a story or multiple stories. Okay, so we'll do this through the lens of the 1980s and the new mysterious disease, certain adventures in frontier medicine. And always keep in mind that whenever we talk about descriptive studies, you cannot quantify what you do not qualify. Okay, so you cannot manage what you cannot define. Descriptive studies help you define a phenomenon, help you define a certain symptom, symptom, a certain disease, so that it can be quantified, it can be managed later on. So the descriptive studies are usually the first in a chain of research studies that you do on a phenomenon. Okay. And let's take this from my own personal uh, context. Okay. So 10 years ago, fresh out of the Doctors to the Barrios program, I was working as an executive assistant to the health secretary. We had just come from the groundbreaking of the new Eastern Visayas Regional Medical Center in Tacloban, where then President Benigno Simeon Aquino III opted to spend the EDSA Revolution holiday to show his commitment to rehabilitating areas affected by Typhoon Yolanda. So TB Patrol segued into this little interest piece about a so-called flesh-eating illness in Pangasinan. Okay. I thought nothing of it until my senior executive assistant reminded me that this was a responsibility of the National Health Agency, and therefore it was totally within my own purview. So within a few minutes, I had to formulate a press statement which the Secretary of Health, so the Secretary of Health, for your information, is this person over here. Wait, sorry. Go back. So this person over here, si Enrique T. Ona, and we had to prepare it, have him approve, because they were creating a narrative that there was an outbreak happening of a mysterious illness. Okay, so what that taught me early on in my career in the medical field was we always have to deal with the sensationalism, including self-styled seers who predicted a world-ending pandemic. And this was a lesson in descriptive studies, because this in its own way, for non-health professionals, is their own way of signaling to each other na, oops, there's this mysterious disease happening here in Pangasinan. What do we know about it? Okay. And it led to me also creating my own email tagline and social media status update that I was advised was too hostile to the media and hostile to the to people in general. And I have been advised not to use it anymore as my email sign off. I only put it here out of humor. So we begin with the most basic of our descriptive studies, the case study, or how we discover new diseases. So back during the 1980s, during the administration of Ronald Reagan, medical doctors were starting to note the appearance of Kaposi sarcoma in homosexual males in the east and west coast of the United States. These areas tend to be liberal and tend to be areas where men who have sex with men are basically not harassed, they are not oppressed, they are not persecuted. So they're allowed to live their lives and their lifestyle. Okay. So there was a case study that came out in 1981 of Kaposi sarcoma in a homosexual man in New York. Okay. Multiple other case studies documented the same phenomena in the West Coast. So in summary, a case study is basically a presentation in a technical or scientific journal of a particular patient presenting with an unusual disease or symptom, so unheard of in our usual cases. It's not typical for their age, not typical for their sex, or not typical for their ethnic background. Kaposi sarcoma usually targets people of a certain ethnicity, usually with of a Jewish background, and it was unusual for it to happen in a healthy male. Usually, it's somebody with an existing problem with their immune system. Okay? And this is why with case studies or when we are in our clinical rotations, it is always important to take a complete clinical, past medical, familial, and social/environmental history in your internal medicine, pediatric, psychiatric, and family medicine rotations. Because these the history that we take will be the basis later on in case the patient that we are seeing is unusual in their presentation in helping write the case studies that we would make. Okay. So the case series is basically an aggregation of case studies. So with regards to the presentation of these homosexual men, they noted that they were presenting with symptoms of immune compromise or a weakened immune system. That's why they were having diseases that normally wouldn't be seen in people of their age, okay, or very rare fungal diseases, okay. So for our students, the case series noted all of these patients, and if you took also the celebrities who were suffering from this disease, a lot of them were also men who have been known to have sex with men or homosexuals. Okay, so that's what was taken. Okay. So for the case series, they noted that Kaposi sarcoma is a rare malignancy or cancer brought about by mutations in endothelial and immune cells that have been infected with human herpes virus 8. Okay. And pneumocystis jirovecii is a rare fungal infection that was also seen in a lot of these patients with signs of immune suppression. Okay. Both these conditions point to immune suppression or a weakened immune system. So for your case series, it's an aggregation of case studies, a collection of unusual cases with similar variables and presentations. So consider the flesh-eating disease story. How were we able to push back against that story and to prevent a public panic? First and foremost, we asked the local system in Pangasinan, hey, are these two patients presenting with the same symptoms? Are the skin lesions similar? And they answered, no, they're not similar. In fact, they're two different presentations. And immediately, the narrative falls apart. Whereas with the case series of this mysterious new disease in the 1980s, the variables and the presentations were mostly homogeneous. Okay, so they were the same, if not similar. Okay, Kaposi sarcoma, pneumocystis jirovecii, and homosexual men. Okay, but as we would later find out, and I think this is an important takeaway here, whenever we do descriptive studies, again, we point out that it doesn't establish a causal relationship as much as possible. Okay, it doesn't establish a causal relationship, and we must not fall into cognitive traps whenever it comes to descriptive studies. These case series, these case studies actually brought about stigma that was not at all helped by the Reagan administration's approach to the new pandemic, which was the human immunodeficiency virus. Okay, it did a lot of damage. It stigmatized and demonized the LGBT, particularly the gay community, because the HIV pandemic was early on called the gay plague. We tend to look at what is sensational rather than look at other variables that do not fit the narrative or model we form in our head. This was very damaging, okay? So whenever we have descriptive studies, always keep in mind we are not establishing a causal relationship uh, between the exposure and the outcome, okay? But rather, the variables uh, seem to be associated with each other. So there might be a different relationship. It might not be causal, it might just be correlated. Okay? So why do I say this? Because these three people, uh, they were celebrities or became celebrities in their own right because of the HIV pandemic. So Eazy-E and Magic Johnson are both heterosexual men. Ryan White was a minor who had hemophilia and needed regular blood transfusions and contracted HIV through a blood transfusion. Okay. Our next kind of descriptive studies are your cross-sectional studies. Cross-sectional studies are not always descriptive, and they're not descriptive when they try to assess the relationship between an exposure and an outcome. So again, uh, whenever we say descriptive study, we are not establishing a relationship between the satellite of variables, okay? We're only showing that they seem to be related or associated. We're not trying to establish a relationship. So some cross-sectional studies try to assess the relationship between, say, an amount of a certain waste product produced by a mine and the outcome, say the symptoms of masculinization for a specific population, such as pubescent girls. In this case, it's no longer a descriptive study, it's now an analytical study. Okay. It is descriptive. Cross-sectional studies are only descriptive when it is used to note the prevalence of a certain condition. So let's just say the number of heart attacks in males in their late 30s. Okay, so the prevalence of a certain condition or phenomenon or disease or symptom in a specific population at a specific point in time. Okay, so the number of heart attacks in males ages 35 to 39 during January to March 2024. So your first quarter of 2024. Okay. And your last form of descriptive study is your ecological studies, also known as correlational studies. So this one, they try to show a correlational relationship. Okay, so correlational link or connection between two variables. Okay, again, they're not establishing a causal relationship. So this is about a population level data. Okay, and it correlates an exposure and of a population to a certain outcome. Okay, so the commentary here or the picture I used is a picture of a certain island province where I used to be deployed as a rural health physician. One day, some of you might become rural health physicians, doctors to the barrios, or municipal health officers, or community medicine practitioners in a mining community, whether it is a municipality or a province. And we are equipping you with the tools needed to be able to make scientific observations that you can report, that you can send to technical journals that can be investigated further. Okay, so that's the reason for the lectures like these. We are already equipping students the understanding and the knowledge necessary so that one day when they are in areas that have certain exposures, they know what to do. They know how to ask for help, or how to communicate with other researchers, with other clinicians, okay, so that further research can be done. So what are the advantages of doing descriptive studies? Descriptive studies can be easily conducted, okay? You already have the data, particularly with case studies and with case series, because you already saw the patients, okay? You already have the variables with you. Maybe you'll do a little bit of follow-up, or the data can be easily collected. Already existing data is there, especially for your cross-sectional study designs, because these are already being conducted, or already being collected by your barangay health workers or by your midwives, or already an epidemiologic study is being done by your provincial health office. Okay. Another advantage of descriptive studies, you are not performing any intervention. You are only doing an observation. No intervention is being performed. So there is not much scrutiny from ethics review boards. All of the health research you will do needs to have oversight by an ethics review board. Okay, so you will need to have it cleared. With descriptive studies, this will easily overcome that barrier because no intervention is being done. Okay, and descriptive studies give you a rough estimate of the disease burden in a population, particularly with your cross-sectional studies, which allows you to optimize your resources. Okay, so cross-sectional studies that are descriptive allow you to make spot judgments and say, oops, we're going to need more birth control resources. We're going to need more birth control devices or contraceptive devices, because we have more women getting pregnant in the municipality, and they have expressed that they want to limit the number of children that they are having. Okay, so that allows you to do resource optimization. The disadvantages of our descriptive studies is that often with our own fellow clinicians, we have our biases or our prejudices. They are often considered weak study designs. Okay, again, because they don't establish causal relationships, no intervention is being done. And for our case studies and our case series, it is usually non-representative of a population, and there is a possible unreliability. Okay, let's go back to the HIV pandemic. Again, because of the sensationalism, because of the cognitive traps, the HIV pandemic was early on dismissed as something that only affects male homosexuals, or males who have sex with men who have sex with men, even though that was not the case. Okay, risk factors include having multiple penetrative sexual partners. Okay, and for our ecologic studies, for our correlational studies, correlation is not causation. Okay, consider this. For example, with our ecological studies, exposure and outcome association is not necessarily true on an individual level. So you have your per capita gun ownership versus gun violence deaths. Okay, in the Philippines, there is actually a significantly low per capita gun ownership officially, and yet we have a relatively high number of gun violence deaths compared to our neighbors in Asia. Okay, Or if we take another route, you consider countries such as Switzerland or Israel, there's actually a high per capita gun ownership because of mandatory military service, where they actually allow their citizens to keep their service weapons. So there's a high gun ownership, domestic gun ownership, and there is a low number of gun violence deaths. Okay, so the ecological fallacy vis-a-vis our responsible gun owners. Another weakness or another disadvantage of our descriptive studies is the accuracy of the tools being used. Okay, unlike your analytical and interventional studies, they don't have the same rigor that require operationalization. Okay, so for example, if I do a case series, if I look at case studies, I might go to vague symptomatology instead of saying a specific skin lesion like papules or macules. I'll just say in general skin lesions. Okay, or I'll have vague terminology. Uh, I say homosexuals during the early days of the AIDS pandemic, by specifically referring to men who have sex with men, or do I also mean by homosexuals everybody in the gay and lesbian communities? Okay, do I also include those who identify as bisexual? Okay, so the again, you have to be specific, you have to qualify, okay, if you want to have a stronger or better descriptive study rather than using yung vague symptomatology or vague terminologies. So with regards to descriptive studies, when we look at it at the big picture, the whole point of medicine is not equipping you with an encyclopedic knowledge so that you have the majority, if not all of the answers. You will not have all of the answers at any given time. So it is important to connect and communicate with fellow professionals all over the world through reading or writing journal articles, no matter where you are in the health system, so that you have insights and knowledge that may not have occurred to you, and vice versa. You may be able to give insight or knowledge to other fellow health professionals that did not occur to them. Okay, so this is the end of my lecture. Are there questions? I will now disconnect my screen. Okay. Are there questions?
Okay, are there any more questions? Sige, kung wala nang tanong, let's just wait for your exam at 10:30. Chillax na lang muna tayo. Review na lang until the exam at 10:30. We'll open the breakout rooms at 10:30. Kindly log on and kailangan nandito kayo sa Zoom ha. Kasi nangyari last time na may isang wala. So, kailangan nandito kayo sa Zoom, nandito rin kayo sa Canvas. Okay? And the usual rules, yung dating Dean's memo on the conduct of the exam, it still applies. Okay? So, see you at log on a little bit before 10:30. So let's just wait for the